This is the presentation on health education and group processes. Here are the Healthy People 2020 objectives that health education in the community needs to emphasize. The educational programs to promote healthy lifestyle and habits are based on age and ethnicity. They include health promotion activities in areas of unintentional injury, violence, suicide, tobacco use, addiction, and alcohol and drug use, as well as teen pregnancy, STIs, insufficient physical activity, and unhealthy diets. They take place in school settings, work sites, and healthcare agencies, and the focus of these programs is primary and secondary prevention. And you know that, as you've heard in other presentations, is that if we put more money and effort into primary prevention, we will decrease the dollars spent in secondary and tertiary prevention. So what's the difference between education and learning? Well, education facilitates learning but emphasizes the provider or the teacher has the knowledge and skills to teach, whereas learning emphasizes the student or recipient of the knowledge and skills and results in behavioral changes. It has a learner focus. There are 3 domains connected to how people learn: cognitive, affective, and psychomotor. Cognitive is the thinking, and this includes memory, recognition, understanding, reasoning. Application, the ability to problem solve and divide hierarchically. Affective domain is the feeling. It includes changes in attitude, development of values. The focus of influence is on what the group feels or values, and it's also comprised of steps. The psychomotor domain is the performance of skills that requires some neuromuscular coordination. So motor skills such as bathing, or bathing a baby, or running, giving an injection, testing blood glucose. This requires the learner has necessary ability, sensory, image, and opportunities to practice. There are general principles of learning, and these include relevance. Relevance means people are motivated to learn the content perceived to be relevant to their lives. Individualization means people learn differently, and the constraints of learning situations differ. So health education encounters must be tailored to the learners and the learning situation. That's why whenever you're going to educate any of your patients, you want to make sure that you know what knowledge they already possess, because you don't want to have to go over that and make it seem like you're the know-it-all. Facilitation is learning can be facilitated by pairing a new desired behavior with the client's usual routine. So for the education process to work, you have to have an effective educator that's able to send a clear message, selects a learning format that creates the best learning environment for those that are the learners, organizes the learning experience, and provides evaluation feedback. Now, when you're talking about groups and group dynamics, there are important things to consider. You want to make sure the members are able to interact positively. The group has a purpose. There's cohesion in the group. The tasks, functions, and maintenance of functions of the group are known to all. There are norms and there's group culture. There is leadership within the group. You want to know the group's structure. There can be some educational issues, so you need to consider the population, that learners differ by cognitive ability, personality, and how much prior knowledge they have, and what barriers there are to learning. The educator-related barriers can be anxiety, use of terminology unfamiliar to the group, and speed of delivery. I've been known to be guilty of that, talking too fast. Learner-related barriers could be attentiveness, like inattentiveness, or level of understanding. Technological issues can also be a barrier to learning too, with regards to computers, videos, internet, whether it's working, whether the person has expertise in audio-visual, like I don't, so I often ask a student. But it also can be individualized and self-paced. In the educational process, you identify educational needs through needs assessment. You establish educational goals. Those can be broad and long-term expected outcomes, and objectives that can be specific and short-term, indicating steps towards your long-term goals. And you want to select appropriate educational material, especially for the level of their cognitive ability. So when you're educating in health education, you want to present positive rather than negative behaviors. You want to facilitate behavior change. You want to have active participation by the learner, because this facilitates learning. Repetition enhances learning. Positive reinforcement is more effective than negative reinforcement. Prompt and accurate feedback enhances learning, and application of information in several contexts promotes generalization of learning. Before you start the actual health education, there are a number of considerations that you need to make. Like, what is the age composition of the target audience? What are their learning needs? Where do they come from? Where are they cognitively? How will the developmental level of the audience affect the ability to learn? What's the developmental level of the audience, and how will that influence teaching strategies and methods? With regard to psychological considerations, you want to know, is the target population aware of the need for health education? Will the audience attitudes toward health behaviors enhance or detract from the learning ability? What is the level of motivation of the learner? And what factors will motivate the clients to learn healthy behaviors? For instance, if you're teaching somebody about medications and how important it is to take them every day, you want to let them know what the benefits are of taking it every day and what are the negative consequences. Okay? Does the target audience exhibit levels of stress or anxiety that are likely to interfere with learning? And what about your physical environment? Does the physical environment have any effects on learning? Are there elements of the physical environment that will distract learners? Like, is it really hot and they're going to be sweaty and they're going to just not want to stay? Is it too cold and they're going to look for something to wear? Are there cultural beliefs and practices that are likely to influence the learning? Are there any factors in the social situation that may influence health education, such as, do they have child care issues at home? So we've already talked about evaluation and planning, and evaluation is ongoing. So what are you going to measure? Well, you can measure qualitatively, and that's how well the learner understands the content, and quantitatively, how much does the learner retain. Evaluation of health and behavioral changes can be collected from questionnaires, scales, or surveys. And so you might want to have a pre-test, post-test when you do your health education. The length of the evaluation period needs to be considered. You could have a short-term evaluation period where you have a return demonstration, or a long-term evaluation where it would be status over a period of time. Now, you're not necessarily going to be in the setting where you'll be able to do some long-term evaluation, unless this is a place that you continue to go to. General principles for health education planning. You need to plan for continued health efforts to resolve identified problems rather than a single program or event. So you want to have the person take home something with them, and that's why we leave something at the site. You want to identify the most effective use of staff time and other resources and discard non-priority activities. You want to identify and plan activities to achieve specific expected outcomes in such a way that their accomplishments can be evaluated. You need to design the evaluation plan at the same time the program is being designed. You want to develop statements or behaviors or attitudes the audience is expected to demonstrate as a result of the health education encounter. These should be stated in measurable terms that allow one to evaluate whether or not the expected results have been achieved. So these are your outcome objectives. So if you end up having a group with low literacy levels, there are a number of things you need to consider. You want to write in conversational style using short sentences and short words. You want to write in an active voice. So we're going to do this. And you want to use simple terminology. If health terminology must be used, define the terms in understandable language. You want to organize the information in related chunks with headings that emphasize key concepts, because you might not be able to keep their attention. Organize content from simple to more complex, and limit content to 3 to 5 important points relevant to the reader. You want to provide examples that are relevant to the reader and that clarify the concepts. You want to eliminate gender or racial biases. Use a large, easy-to-read type font and maintain consistency in the fonts used. So don't go back and forth. Use lowercase letters as much as possible since they are easier to read than uppercase. Leave the right margin ragged rather than justifying it. So you're just going to justify the left margin. Make points stand out with judicious use of white spaces. So if you want something to really stand out, leave a couple of blanks and then write what you want to stand out. Select pictures and graphics relevant to the audience and the content and place them appropriately in the text of the message. Pilot test your material with members of your target audience. So you might want to try it out, but you might not have the ability to do that. So if you do it, it's fine. If you don't, that's fine too. So this is an example of what your teaching plan, like an outline of what your teaching plan is going to look like. So you need to have at least 2 to 3 objectives. In the next section, you want the content that you're going to be teaching, and it has to be related to each of your objectives. So you can't put anything in the content section that doesn't have anything to do with the objectives. So your objectives will be very generalized. Then you want to put in your specific teaching strategies and make sure they're specific. Are you going to lecture? Are you going to demonstrate? Whatever you do will be your teaching strategies. And then in the last column, you'll have your evaluation method, and these should be measurable. So here's what your teaching plan is going to look like when you have it all filled out. So you have your objectives in the beginning, and so objective number 1, the participants will be able to list 3 reasons why being happy improves overall health. And the objectives that go along with that are the description, physiological symptoms of unhappiness, list, blah, 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 blah. And then your specific teaching strategies are in the next column. So lecture, you're going to provide detailed content. So what you want to do here is if you're going to do a lecture, you need to at least provide an outline under this section. Then you're going to demonstrate, you're going to show participants a diagram of the physiological impact of unhappiness. And then after the program, you're going to list 3 reasons why being happy improves overall health. And if the participants are able to do that, then that's really very objective evaluation method, and it's measurable. If you have any further questions or you need help, you should contact your instructor with specific questions so they can help you out. You can always go back to the Lancaster book and read the specific pages that talk about planning an educational program.